Hang tight. Thank you.
Kate, I'm back.
Great.
All right, so we'll start over. Good afternoon, everybody. Welcome to the Maine Health Data Organization's first webinar on Rule Chapter 570, Uniform Reporting System for Prescription Drug Price Data Sets. We know you're all very busy, so we appreciate you taking the time out of your day to join us. And we will get through this as quickly as we can and make sure that we leave time at the end for questions. Lana, if you could go to the next slide. So just a couple of things, reminders, all participants' audio has been muted, and we're asking that you submit questions via the webinar chat feature. There's over 200 participants on the call. So we feel that's the best way to manage this as we go forward. And we will try and address as many questions as possible at the end of the webinar. And for those questions that we are unable to either answer over the phone or get to, we will post the question with responses on an FAQ that we'll post in our new pharmacy portal and on the MHDO website, and we'll talk to you more about where you can find those resources. And then lastly, a recording of the webinar will be made available on the MHDO website. So just quickly, I have a number of folks on my team that are joining me here today. And again, I'm with the Maine Health Data Organization, and we are contracted with HSRI. We'll talk more about that in a few minutes. And they handle all of our data warehousing and management, et cetera. And there are a couple of folks from HSRI that I'll be turning this presentation over to, Leanne Candora and Kate Mullins. So just quickly, we want to spend a little bit of time with an introduction to MHDO and the relationship with HSRI. And then we want to spend time talking about Chapter 570's requirements, and primarily spend time focusing on Part 1, which is the registration and notification requirements. We'll do a demo of the portal, which is where you will go to review the information that we've already got and update as needed. And then we'll spend a little bit of time talking about pricing component data submissions, or Part 2 of the rule, which we will have a separate webinar early spring to talk about the requirements there. Then we want to get into just reviewing the implementation timeline, share with you resource and technical support information, and then again we'll take time for questions. So real quickly, MHDO, or the Maine Health Data Organization, is required by Maine state law to collect data from prescription drug manufacturers, wholesale drug distributors, and pharmacy benefit managers, and we'll be referring to sort of this block of entities as reporting entities. And the data and information that we're required to collect is described in Rule Chapter 570, which again is defined as Uniform Reporting System for Prescription Drug Price Data Sets. And you can find a copy of the rule on MHDO's website, and you'll find the link listed below. Next slide. So as I mentioned earlier, MHDO has partnered or contracted with Human Service Research Institute, or HSRI, and its partner, NORC, at the University of Chicago. And they support all of our data submission and warehousing activities. So you will most likely be receiving emails from either HSRI or NORC and or MHDO. So just wanted to make sure that those emails don't get caught in a spam or any other kind of folder like that. It would, again, you could receive emails from one of the three entities. So just real quickly before I turn it over, again, we have set this up. We've received emails and phone calls from many of you, and we thank you for reaching out to us regarding the registration and notification requirements that are in the law. And so we want to spend the bulk of our time with you today talking about those requirements and the timeline and how you do it. And then part two, the actual data submission requirements in the rule, we will talk about on a webinar that we'll schedule early this spring. And so with that, I'm going to turn this over to Leanne Candora with HSRI, who will walk you through, I think, the next couple of slides.
Thank you, Karen Lee. So as Karen Lee mentioned, I'm just going to pick up where she left off. We are going to cover two main components of the data submission rule today that's covered in part one. So that is the registration, that applies to all reporting entities. And then the second part of part one is the notifications by manufacturers. And then we're going to pivot in just a high-level overview of the part two requirements, which is when MHDO notifies the reporting entities for pricing component data. So as we've mentioned, the reporting entities that we've been discussing are prescription drug manufacturers, wholesale drug distributors, and pharmacy benefit managers. A reporting entity is defined and identified by their unique U.S. tax ID. And we understand that that may also represent more than one of the type of reporting entities. We've heard from a few of you who are both, for example, manufacturers and drug distributors. We only require one registration. So each reporting entity must register with MHDO. We've pre-populated the registration information that we already have on hand, and much of this information comes from licensing or other types of registration within the state of Maine. So when you go into our portal to register, there will be information that is already in there about your entity that we are looking to you to update and enhance. So for the registration, it is required that you register by next Thursday, January 30th. And then annually thereafter. So when you get your login information, an initial user who has been identified for each entity will receive an email from the portal, which is the email listed on the screen. So that's portal@mhdo.maine.gov, containing your user credentials. Once you receive that email and are able to log into the portal, you will see the information that's been pre-populated and then either update that information because there's more, the information may be out of date, or also you will be adding new information and additional users for your reporting entity. For wholesale drug distributors and PBMs, updating your registration is the only requirement at this time. And so when my colleague Kate demos the portal in a few moments, you'll be able to see in more detail how this process will work. So for manufacturers, there is a second item that you must complete during this initial phase. We're calling this the notifications by manufacturers. No later than March 31st of this year and then January 30th of each year thereafter, a prescription drug manufacturer must notify the MHDO via the MHDO prescription drug portal when the manufacturer has, 1, increased the wholesale acquisition cost of a brand name drug by more than 20% per pricing unit, or increased the wholesale acquisition cost of a generic drug that costs at least $10 per pricing unit by more than 20% per pricing unit, or introduced a new prescription drug for distribution in the state of Maine when the wholesale acquisition cost is greater than the amount that would cause the drug to be considered a specialty drug under the Medicare Part D program. For this year, only those price increases on or after September 19th, 2019 through December 31st, 2019 count towards the thresholds during this first year. The rule in which this data is being submitted under was enacted on September 19th, and so that would be the start date of reporting for this year. Thereafter, the reporting period is based on the previous calendar year. And so this information will be contained in the portal as well as a reminder that we're only looking at price increases between September 19th, 2019 and December 31st. So at this point, I'm going to hand it over to my colleague, Kate, who's going to give you a little demo of what the portal looks like.
Great, thank you, Leanne. I'm just going to get this set up. Leanne, if you could unshare, that would be great. Thank you. And Leanne, can you just confirm you can see my screen?
Kate, this is Karen Lee. I can see it.
Thank you. Okay, so thanks all. I just wanted to note that I did see one question. We have not sent out the initial email with the first user account credentials yet. That will be coming by the end of the day tomorrow. So you have not missed anything yet. So before we get started, I just want to make sure that's clear. And we will be sending an email to all of you that receive this webinar invite that lets you know what the steps are, provide some written documentation as well. So again, this will be giving a demo now, but there will also be supporting written documentation to walk you through this process once you have your credentials in hand. So first, I just wanted to note at the start that once you're here at this login screen, there are a couple of things that may become useful later. First is that there is a feature for you to be able to recover an existing account. If you forget your username or password, you can come here and select that. We also have the help desk email address available here. So I'm going to log in with a demo account and just walk you through some of the steps that Leanne just went through in her slides. Once I'm logged in with my user account, I'm first going to just point out up here in the top right corner, there is a hello and your user name. And by clicking on this, you're able to make some updates to your own user account if you'd like. The first that you may want to do is going in to change your password. So that feature is here. There are password requirements that are available in our user manual and then will be communicated to you via this screen. You can also edit additional details for your user account, including your name, email address, phone number. If you'd like to change the username that's been pre-assigned, you can, and then you can also update some of your user roles, which we'll talk about in more detail. So the other thing to note once you log in is that we're going to display a bunch of information right here on the home page that will become useful. First is that it clearly displays which organization that you're, or entity that you're logged in under currently. Some of you may be associated with multiple reporting entities, and this will be sort of your guide to show you, who you're working under at that time. You'll have one user account, but you'll be able to toggle between multiple entities. The other thing to note is that we'll be posting information on this page in terms of any announcements or upcoming deadlines. We have the ability to post that information here in addition to sending you emails. This will be a good resource for any updates. And then the other thing to note here is the activities that you'll be performing over this next week in terms of registration and manufacturer notifications. This will give you a clear status update of whether you've met the requirements yet. So this demo account that I'm logged in under is a manufacturer, so they are required to complete an update to their summary information, which is the organizational information, provide the manufacturer notifications, and then also update the users. So So you'll see that at this point, all of these are incomplete, and as we walk through the steps, we'll see these change in their status. So the first thing that I'm going to do is go to the summary screen. Again, this contains information that we've pre-populated and that you're going to be reviewing and either updating or confirming. So in order to do so, we click on the button Confirm 2020 Registration Update, and I'm brought to a form that we're able to edit. The only field that you're unable to edit yourself is the U.S. tax ID. If that information needs to be edited, we'll ask you to contact our help desk. And again, this is all documented in the user guide that we'll be distributing. So once you make your edits, you'll just go down to the bottom of the page and confirm your 2020 registration. It immediately brings you back to that home screen and shows that our summary requirement is now complete. The next step I'm going to go through is the users. Again, we've pre-populated one initial user and given them the status, the role of administrator, and this person will then be able to go in and confirm their own information and identify additional folks and assign roles to them. There will be 4 different user roles, and again, the details of these roles will be in the user guide that we distribute. There's an administrator, compliance, submitter, and assessment role. And a single user can serve multiple roles. So again, what we're asking you to do here is to review the information for the pre-registered user. And if you need to make edits, that can be done by clicking Edit. And the other thing that I'm sure many of you will be doing is actually adding another user. Once you complete all of the required fields, you then enter which user roles you'd like that individual to have and click Save. And once you do add additional users, the next step will be to, again, just hit the Confirm Registration Update 2020. And here you'll see that if you have not identified a person for all of the roles, you'll be prompted here letting you know that that is missing. So I'm going to go back to this user, and just for the purpose of this demonstration, I'm going to say this single user is going to hold all the roles, save that, and now try and confirm my registration again, and I was successful. So now the user's requirement is complete. So if you are representing a wholesale drug distributor or a pharmacy benefit manager, this is all we're asking you to complete for Part 1. Reviewing your summary and your user information to ensure that we have the correct information for your organization and we know who to properly communicate with going forward. If your entity is a manufacturer, you must also complete the notification requirements by March 31st. You do that by going to the notification screen. And here you'll see the 3 questions that we reviewed that are in the rule that you'll be asked to respond to. And to do that, again, clicking the Confirm Registration Update link, and you're brought to an editable screen. You'll answer each of these questions by selecting no or yes from the drop-down. If you select yes, you're prompted to include a NDC code that applies to this response. If you need to add more than one, we just go ahead and add a line. And again, once you've made your appropriate changes, you confirm the registration. And now all of these requirements are complete. So that will be it. If you're a manufacturer, that would be the last step that we are asking you to complete by March 31st. And again, we're asking that to the date range that it applies to is September on or after September 19th through December 31st, 2019. And the other features that I just want to quickly go over here is that here through the portal, you're going to have access to, again, contact information for both the help desk and MHDO. You'll also have access to a user manual. Again, we're going to distribute that via email as well, and an FAQ that will be continually updated and available here. So once you have completed all of those requirements, you can come to your top right part of your screen and log out. And that's it for the demo of this first part of the Chapter 570 requirements. I'm going to hand it back over. Sorry, go ahead.
Kate, this is Karen Lee. There are a number of questions about registration,
Sure.
and where that's really the focus of today. I think maybe it would make sense to just take a minute and respond to some of the questions that are being asked. And one that's a common theme is, how do people know in various organizations who the credentials and emails going to? These are big organizations. They don't necessarily know who is the contact at licensing where we got this information. So Kate, what are we doing with that? Can people call us, or how are we handling that?
Sure. So for the most part, if you received this initial, the invite for this webinar directly, you are likely the person. The other option would be to contact our help desk. Email would be preferred. If you could email us the U.S. tax ID for your organization, we can tell you who will receive that email.
Super.
And I'll just stress again that U.S. tax ID will be kind of the unique ID that allows us to quickly identify which organization we're discussing. So that would be super helpful if you provide that.
A couple of other things. So the information that will be collected and maintained in the MHDO prescription drug price data portal in terms of contacts and so on and so forth, that is completely separate from what you do, whatever the requirements are for each of you within the state for licensing or registration in other ways. We were just leveraging information that another state organization had so that we could hopefully streamline the registration process for you all and not have to make you repeat a lot of the information that the state already has. But again, just to be really clear, our registration is a completely separate process from whatever requirements you have within licensing or other state entities. The other question was if the user that we identified is no longer with the company, this is your opportunity to make the appropriate updates, as Kate said, and identify who the correct contact folks are. And I think that was some of the more common questions around registration. So Leanne, I'll turn it back over to you.
Thank you so much. So the next few slides, again, this is for the future update to the portal. We will have another webinar in a few months to go over this, but we just wanted to quickly review the part 2, and this is where MHDO is notifying manufacturers, wholesale drug distributors, and pharmacy benefit managers about which NDCs we would like some additional information about. So on or before April 10th of this year, and then February 15th of the following years, the MHDO will notify you via email that there are required reporting elements that we need additional pricing component data on from your organization. And these are outlined in sections 2J of the MHDO reporting rule, and for manufacturers, it's 2J1 or 2. For wholesale drug distributors, it's 2J3, and for pharmacy benefit managers, it's 2J4, and this provides the detailed information about which data elements we will be asking you to complete for the NDCs that have been identified. So once you have received notification for further pricing component information, you will have 60 days to comply with the reporting of that detailed information. And again, all of this will be handled through the portal. We will have Excel documents that we will be sharing with you that would contain the pricing component information that we need submitted. Those will be provided, and then we will be asking you to upload them into the portal 60 days after the notification. It is MHDO's intent to focus the reporting of the wholesale drug distributors and pharmacy benefit managers on a select set of NDCs, and we'll be looking at some of the reports that MHDO produces for the top 25 most costly, most utilized, and those with the highest year-over-year increases as identified in MHDO's annual pharmacy report that is required by Maine state law. So the information that is used to produce these is from MHDO's all-payer claims database. That information is available through the MHDO website, and we will be selecting and identifying NDCs as part of this effort. So I did want to take a few minutes to go over the timeline so you will know what to expect over the next few months. Today, January 23rd, is the webinar. So that is the first date on this calendar. The MHDO prescription drug data portal, which Kate just demoed, will be launching by tomorrow. So those who are administrators will begin to receive those email notifications from the portal to go in and start the registration process. That period of the process will be open from tomorrow through the 30th to complete the first steps of the registration and identifying users. For manufacturers, they must complete their annual notifications by March 31st of this year. And then we will begin part 2, where you submit the pricing component data. That portion of the portal will become available in April. And that is also when we'll hold our second webinar that will go into more detail about the pricing component spreadsheets and how those data get populated and then submitted. And so that takes us through June 10th, which would be the 60 days post when those notifications go out. So as a reminder, some of the resources that have been mentioned throughout today's presentation, there's the MHDO website where you can find the current prescription drug price reports and the rules and statutes where you can find the details of Chapter 570. There also will be a page that is just for pharmacy data submitters. So we'll provide the link to that when it becomes available. And then most importantly, as we've shown today, is the actual data submission portal. The link is listed here, and when the registration emails go out tomorrow, it will be directing you towards this portal. In addition, we have a number of technical support options, the MHDO help desk, and this desk is available during business hours, 8 a.m. to 5 p.m., Monday through Friday. As we mentioned earlier, the email is really the best first step, if possible, when connecting with us. Please provide your organization US tax ID with your questions to make sure we can most efficiently answer your questions, but we also offer a toll-free number. In addition, any compliance or assessment related questions can be directed to MHDO's compliance officer, Philip Bono. His contact information is listed here as well. So we have received some questions to date. We'll start by reviewing the questions that we've received, and I know that there's been a number of them coming through the chat feature, and we want to leave enough time to be able to address all of them. So I'll briefly go over the ones that had come in prior to the presentation. So first was if a pharmacy drug manufacturer, wholesale drug distributor, or PBM was required to register even if not licensed in the state of Maine. The answer to that is yes. The next question, are virtual manufacturers required to register? And because virtual manufacturers meet the definition, they are required to register. And then the last on this slide is how can a US tax ID and an organization summary be updated? And if you need to update your tax ID, please contact our help desk. The next set of questions were about data submission. The first was, can a third-party provider report on behalf of a pharmacy drug manufacturer, wholesale distributor, or PBM? The answer is yes. Next is, does a prescription drug price report data portal support access to more than one company account with a single login? Again, the answer is yes. And then finally, are wholesale drug distributors and PBMs required to report for all NDCs? And the answer is to no. As I mentioned before, it's MHDO's intent to focus the reporting for wholesale distributors and PBMs to the top 25 most costly, utilized, and with the highest year-over-year increases. Okay, so I think what we're going to do now is start to go through the questions that came through the chat feature. Some of these may have been addressed already, but we want to make sure that we can go through as many of these as possible in the time remaining. So Karen Lee, I know that you've also been reviewing the questions while I've been talking. Should I just start by reading through them, or is there anything else you would like to say before that?
No, I think that's fine.
Okay, so the webinar slides will be sent out along with the recording of the presentation. So we'll have a copy of those available for participants. If your entity does not receive a registration email tomorrow, please make sure you contact our help desk. But as we mentioned earlier, if you received an email for this webinar, it is most likely that you are the contact that will be receiving the portal registration form. So the next question is, if we update information in the portal that has been populated in accordance with license information, will it affect a company's license status? I think this was mentioned before. The answer is no. These are two different entities within the state of Maine. The next question is, how does all of this apply to contract drug manufacturers who do now, I don't know if that's supposed to be not own, who do not own any of the products manufactured?
And I think, Liam, this one will follow up in writing.
Okay, great. All right, we answered the question about virtual manufacturers. Will the intro of new product notifications require any and all products introduced between September 19th and December 31st, 2019? The answer to that is, I think it must meet the requirement of being a specialty drug to require to be reported for that time period. And then in going forward will be any and all intro of new products for previous calendar year. So only those products that meet the specialty drug criteria. Our company is new and did not receive your original invite. So you can please contact our help desk and we'll make sure that you get an account set up if you are new. For the first year of reporting, do new drug reporting requirements follow the same rules as price increase reporting requirements. Specifically, do we have to only report drugs launched from September 19th to December 31st, 2019? MHDO, can you confirm that that would be a yes?
We'll follow up in writing on that one as well.
Okay, great. The next question is when we'll be able to make a login to the portal. We are aiming for tomorrow that the emails will be going out for the portal for login. Do the new rules apply to outsourcing facilities with unapproved drugs? Also, do they apply to mail order pharmacies? MHDO, do we have a response to that at this time?
We will follow up in writing.
Great. The next question is, does the company still need to register if we are pre-commercialization?
We will follow up.
Oh, great. If there is no WAC increase, do we still need to submit notifications? I think the requirement for notifications is if it meets the criteria related to increases.
And so I think, Leanne, correct me if I'm wrong, but manufacturers that does not have an NDC that hits any of the thresholds, they still would have to go in and indicate no, right? So
that is correct. So just to confirm that we know that you did not have any increases.
So notifications are required whether it's a yes or a no, and if it's a yes, there are NDCs that hit the thresholds you need. That's when you'll be prompted to indicate what the specific NDCs are.
Thank you. For PBMs, are there any specific lines of insurance or plan types excluded? I think we'll have to follow up in writing. What do we do if the user that Maine identified is no longer with the company? You would need to email the help desk and we'll get that adjusted. Are the user roles defined anywhere? Yes, they are defined in the user manual, and that will be sent out when the registration in the portal opens. Is registration required for veterinary only wholesale distributors?
I'm comfortable answering that one right now, and the answer is no.
Okay, thank you. Can someone who's in the submitter role complete responses to the section?
No.
No. Can you clarify that, Kate? So you would
Yes.
roll.
And again, this will be defined in writing, but the administrator role is the only one that can complete the steps that we walked through earlier.
So we have a question.
And multiple people can hold that role.
Thank you. If we launched a drug in July 2019, does this not need to be reported since it was prior to the law going into effect?
And that will follow up. There's similar earlier questions like that, so we'll follow up in writing.
Great. Is there an annual fee for registration?
No.
And then there's a question about which email address. Let me just put the email address back on the screen. So it's the MHDO help@hsri.org, just so it's available. There was a question about virtual manufacturers that I think we already answered. Sorry, I'm just reading through a couple of similar ones. We will be sending out a copy of the webinar. Does brand name drug mean drugs with a trademark name, or is it based on the application type, such as NDA?
We will follow up in writing.
Okay. Okay. And then there's some more questions about, are we only reporting on products that hit a certain threshold? And that is defined in Chapter 570, what those thresholds are for reporting. Can we see the notification screen again?
Sure.
Okay. I will stop sharing and we'll go back to the demo and I'll continue looking through the questions. And I'll go to the end of the questions in case people have more specific questions about the demo. We can make sure that we look at it again.
Okay, so I have it up, and here you can see, just going back to some of the earlier questions, if you have nothing to report, nothing that's met any of these thresholds, you would keep the drop down set to no and hit save.
Kate, we can't see the screen.
Okay. Try again.
It's up now, thank you.
Okay, yep. Okay, so I'm back in the notification screen. I'll just go back to show how I got there. So this is my home screen. On the left-hand navigation menu, there's a notifications link. And so again, going back to some of the earlier questions, if you have nothing to report, you still need to come in here and leave all of the drop-downs set to no and hit save. If you have something to report that has met any of these thresholds, you'll indicate yes, and then include the NDCs that apply. And again, we've put in here, right in the screen, the dates that we've been talking about.
Thank you, Kate. I'll let you keep it just while we go through some other questions.
Sure.
There's other demo questions. So we will be following up in writing with these questions. MHDO, there's a question about the $500 fee and when it is due.
We'll put that in the FAQ as well, but there will be a notification that goes out to folks, and that will be the trigger for payment, and it will include the due date. And it's not, it won't be until I think sometime in July, so when the notice goes out.
And there's a compliance contact in the portal. Can we clarify around that, the user it will be sent to?
It'll be sent to the assessment user role.
Thank you, the assessment user. So that is one of the roles that's defined in the portal. So the $500, Karen Lee, there's just a couple questions about, is it one time or annual?
It's an annual assessment. And again, we'll document this in the FAQ, and it's also described in a rule, another rule, Chapter 10, that is working its way through our legislature. It is a major substantive rule. So as soon as that's all buttoned up, we'll send out a separate notice with a link to that rule as well.
Okay, so I know there's still a number of questions that have come in. We are going to be doing our best to respond to all of them in writing. All of the groups, the manufacturers, drug distributors, and PBMs do all need to register. This is being recorded, and we'll send out the slides.
Leanne, if I can just add, I just want to clarify, my apologies, folks. Rule Chapter 10, which is the rule that governs the assessments, that's actually a routine technical rule and not major substantive. I was confusing that with another rule. And so our board has approved the changes to Chapter 10. It's working its way through our Attorney General's office for final review and approval. So as soon as that all works its way through the process, we'll notify folks. But I just wanted to correct myself. Apologies for any confusion.
Okay, so I've scrolled through the questions. I think for the most part, the ones that I think could have been answered during today's webinar have been answered. There is a question that just came in about how can I be assured that protected business information will be maintained in a secure fashion? We will address this in our responses. That is of high importance to us as well, that all of our systems are built for security. So we'll share that information back out. And
Leanne, this is Karen Lee. I just want to add to give folks some comfort. So the Maine Health Data Organization collects all kinds of healthcare data, and we collect data that includes PHI, PII. We collect data on charges, payments, all kinds of sensitive data. And there are rules that govern how that data can be used internally, externally, et cetera, just like the new rule around the data that you'll all be submitting. And one of the reasons why we went through an RFP process and we had over, I think, 10 vendors submit proposals. We selected HSRI and NORC in part because of their systems and infrastructure around data security. So I want to reassure you that our data vendor complies with all of the federal requirements around security, the state requirements around that. It is of utmost importance to our organization that the data we collect is in a safe environment at rest, and that the transfer when we're receiving data in is secure. So as Leanne said, we'll put that in writing for you all, but just wanted to also reassure you that that is of highest priority for us.
And I've just gone through the questions. I want to ask Kate and Karen Lee if there's other questions that you've seen that we think we can address at this time. Okay.
I think, Leanne, you've hit the majority that we can respond to, and over the phone. And I think we'll go ahead and start working on an FAQ. And if folks have questions and they want to talk to either myself or please don't hesitate to reach out to us. We're very excited about working with you all and building relationships with you as data submitters. Not sure you're all excited, but we are, and we're here, and we want to help make this as painless as possible. So I think with that, Leanne, we can probably conclude today's discussion, and we look forward to the next time we connect to go through part 2 in more detail and do a demo of the portal for that, for data submission. So with that, I think we can go ahead and conclude the call. And again, thanks everybody.
Thank you.